Hi everyone, it's JoJo Magnolia. Because I'm now getting older. Bingo! And listen, today I want to tell you about something that's a really kind of an epidemic around the United States right now. And as we talk about it, I really want people who have parents who are living in retirement centers or nursing homes or over 50 communities to really pay attention to what I'm about to talk about here. What happened was I was talking to some friends one day, and I had told them I was doing some research on STDs, and they didn't know what that was. And I went, okay, that needs to be my next show. And when I say it's an epidemic, it truly is. First of all, STD, sexually transmitted disease. That's what it stands for. It's a disease caused by certain, it's an infection, and it's caused by certain bacteria, viruses, or other microorganisms passed from one person to another through blood, semen, vaginal fluids, or other bodily fluids with an infected partner. So mainly what's happening is people are getting STDs in the 55 and older age group at an alarming rate. And I want you to know what the symptoms are. Sometimes it includes sores, blisters, bumps on genital areas, pain or burning during urination or having sex, unusual drainage or bleeding from the genital areas, swollen lymph nodes in your groin areas. That's just some of the symptoms. Now, this is informational purposes only. If you have some of the symptoms, you contact medical advice and seek medical advice for a diagnosis from a professional. I'm just giving you information. I'm not here to heal, treat, otherwise anything other than telling you what the facts are. And a lot of my facts are coming from the CDC. And then there's some doctors and professors that I've looked up and read a lot of information on this about. But please, if you think anything is necessarily wrong with you, you contact a medical professional. Okay, so STDs have more than doubled in the age 55 and over from 2010 to 2023. That's a decade. Of course, we don't have the statistics for right now. Some of the things that have you may have heard of before is chlamydia. It's tripled in that time period. Gonorrhea has folded six. It's a six-fold problem, 6 times greater than it had been. Syphilis, 10 times greater than it has been. And during the pandemic, there was a 24% increase in people 65 and older. And the possible reasons for this is living to be older and we're having more sex because of drugs or vaginal creams or moisturizers or whatever. Men using Viagra. We don't have an understanding of how it works or how it spreads. One of the things that's happening are these dating apps. I mean, I've heard people on TikTok, Instagram, YouTube talking about the dating apps for people our age. And they encourage people to hook up, and they encourage us to be more like them, actually, the younger people. But they don't tell you anything about, we're a condomless age group. No one told us, carry condoms with you wherever you go. I told you we were living longer. 31% of women aged 65 to 80 are sexually active. 26% from 60 to 69 said they have sex weekly, as did 17% of those over 70 and older. One of the things that they're saying about us all being older, we have what's called a partner gap. And this means that women are outliving men 6 years longer. And so older men are having multiple partners with low or no condoms whatsoever. And it's spreading like wildfire. And you can go check all this data out that I'm giving you. It's from the CDC. The data's there. You can read it. And one of the things is when you do meet these partners, women and men are not asking them about their sexual history. You know, how many partners have you had? There have been a lot of discussion about the different types. And I told you a couple, but there's human myeloma virus, that's one, HIV, genital herpes, chlamydia, gonorrhea, and syphilis. Those are the ones that you normally hear about. But all the others, there's many more. And you can all look this up for your own. Under STDs, it's there for you to see. One of the things we need to agree upon is that it is an epidemic. And it's going to continue. And here we thought we were going to die of old age, but we're dying of something that we could have prevented. So please, talk to your doctors, look up the information for yourself. If you're going to be dating someone who is in multiple partners, and I'm talking to people who are in these 50 and above communities, people who live in these assisted living facilities. I'm talking to people who live in nursing homes, anywhere where older people are gathering. And I understand how people hook up to each other. I understand wanting to have that warm body next to you or whatever. But I also understand that we're hurting ourselves. And I'm here to help you. I want you to have a great life and be healthy. So be wise. I know it's embarrassing to carry condoms, but if I were you, I would certainly look that up and maybe buy some and talk to your friends about this. I want to tell you one story real quick. I had a friend that was a urologist, and he had a patient that he had done some surgery on. He was an elderly man in his 80s. And he said, you know, one night I get a call after I'd done surgery on him the day before. I get a call from the emergency room saying my patient's in the emergency room and he's hemorrhaging. And he said, well, he didn't live far from the hospital, so he jumped up and he ran to the hospital. And what he said with the man's wife and him there, and he said the man's wife was very elderly as well. And he said, what happened? What happened? What did you do? What caused this to? I want to know what happened. And the man said, nothing. I didn't do anything to make it happen. And then the doctor finally looked at him. He said, after he went down the list, a multitude of things, he said, did you have sex? And the man said, well, yeah. And the wife chimes up and goes, yo, fool, I told you not to do that. And that was, my friend told me, the very last time. He never told anyone that was any age whatsoever. He said, I always told my patients from that point forward, don't have sex. So see, there's just because we're older doesn't mean we're not human. Anyway, you guys have a great week. Look forward to hearing from you at JoJo@JoJoMagnolia.com. Please write me and tell me about your stories, the things you want to hear about. And like I said, I'd love to hear from you. Take care. Bye.